And we are actually live. So if your students are here, go ahead and check in, and we will rock and roll in just a minute. So hopefully they'll start coming in. Yeah, so they're more or less muted. So if anyone comments, they just type in. Every once in a while, have a colleague or two or other students in the program. We'll say they're here, ask a question. Or I'll hear from my mother-in-law. I always ask her to say hello, because she always pops over and says,
and of course, now we're losing you a little bit.
Yeah, we're losing you again. Sorry. It's us.
I still see you and hear you fine.
It's so weird. We were just fine there for a second.
All right. Well, I lost Beth and Gretchen from Apex PT, but they'll be right back. So Addison, I see you. Jennifer, Haley, hello, Turn, Henny, Lexi, Heather, Bethany, and here are Beth and Gretchen are back. So all my students are checking in, saying hello.
Oh, there they are. Perfect.
Yeah. So they're all popping in. I'll give another minute or two, see who all is here. Michael. Awesome. Bethany, Matthew, Kaylin. All right. So I'll go ahead and I'll keep taking attendance to be aware of that. But all right. So thank you for joining us, as always, students. And hopefully we can get together one more time before the semester is out. I know it's been a little crazy and things are changing on campus right now, but I'm glad this is still working out. Today we are here with, well, it says Apex Physical Therapy, the network, but we're here with Beth Hall and Gretchen
Gears.
Gears. So, sorry. So, from Apex Physical Therapy. So, several clinics in the area and different physical therapy companies in the area. But I just stopped by Apex the other day in Webster Groves, and I was blessed to meet Beth. So, we got talking a little bit. So, I think today will be good. And so, if you guys want to introduce yourselves a little bit, talk about what you both do for Apex overall, and then your clinic right there, that'd be great. Did you hear all that?
So I missed some of that.
Just to introduce yourself, who you are.
Just a second. I don't know why it's freezing.
Yeah, we're losing
you. Yeah.
Are you wired in? All right, so I might have to do the comment route.
Yes.
Can you hear me? I might have to go to the comment route.
Do you need us to do it into the office? You want to do it from the desktop?
Yeah. Or no, we can just move this in there.
Okay.
Might be this room.
It could be this room. We're going to walk with you. We're taking you with us.
I can do this real quick. Give us 1 second. Sorry about that. We were cutting in and out, but now you seem fine, actually. So okay. Do you want to introduce? Do you want to do the spiel again? Sorry.
Yeah, I was going to say, if you want to, can you hear me now?
Yeah. Yes. Yeah. Now you're perfect.
Okay. If you just to introduce yourself. I said I just stopped by. I stopped by Apex Physical Therapy the other day and kind of said hi to Beth. I was lucky to meet her, and so I just wanted to ask you to introduce yourself as far as that you are at a clinic in Webster Groves, but you do more than that in the entire region. So if you can talk about that a little bit.
Yeah, so my name is Beth Hall, and I've been in the Webster Groves location for about a year now, a little over a year. And I've actually been up to talk to Martin in the training room and things like that. So we like to work with other entities so that we can spread the therapy love and all of that kind of stuff. But COVID has kind of put a damper on that to some degree.
Sure.
But just as far as a little bit about my background, pretty varied. I've done a little bit of everything from outpatient ortho, which has probably been most of my career. I did a little home health for a small window. I worked for hospital settings for small windows. I've managed physician practices, done a little bit of occupational medicine. But that's the great thing about therapy, is you get to do a lot of different things. There are a lot of different avenues you can go down. Being a physical therapist. So you can get into administration, you can get into workman's comp, you can work with athletes and, go down the sports avenue. You can do women's health. You can get into concussion and vertigo. There are just so many different things, different opportunities with physical therapy. So thankfully, I've gotten to do most of those things. My niches are, I'm certified for dry needling. I'm certified for, it's called the McKenzie method, which is a spine certification. I'm certified in FCEs and job site analysis, which is kind of a workman's comp certification. And then a whole host of other things that we've kind of taken off on different tangents with concussion and vertigo, and especially since that kind of became very prominent as far as the media's coverage of concussion a couple of years ago. So providing that as well.
So a few questions to back up a little bit with your, you said outpatient versus, is it inpatient? Is it hospital? When you talk about being more of a hospitalist or working in the hospital, I know we have one or two students interested in that. Can you talk about the difference between that a little bit, or what's a PT in a hospital doing?
Sure. PT for a hospital can do lots of different things. It can be inpatient, so you might be working on an ortho floor with post-op total knee replacements, post-op total hip replacements. So if you're on an orthopedic floor, you might be working in a neuro floor where you've had somebody who's had a gunshot wound and has a spinal cord injury or has had a head injury. So it can be lots of different things. Sometimes therapists get involved in wound care. So we do debridement of wounds and dressing changes and things like that. And again, it can even be, towards women's health and working with bowel and bladder function, things like that, and working with urology. So you can take a lot of different roads with that, but hospitals also employ outpatient physical therapists as well. So it could just be strictly outpatient ortho. You could be doing home health for them after patients are discharged, in between the time they are discharged from the hospital, but before they make it to outpatient. Sometimes there's a little bit of a window there where they're not able to get out on their own or don't have, a family member that can drive them. So home health is always kind of an option too. So hospitals afford you lots of latitude, basically, as far as paths that you might go down. And then you'll work more closely with occupational therapy and speech therapy when you're in the hospital setting as well. A lot of outpatient facilities, kind of like mine, they're less likely to have, for sure, less likely to have speech. They may have OT, but the OTs aren't quite as plentiful.
Okay. That's what when we go to our pediatrician at Mercy, there's the outpatient PT clinic right there. Mm-hmm. But I know I visited a client who fell and broke his hip at St. Luke, and that PT was on the orthopedic floor, like right across from his room was those, they're getting him up out of bed, walking him down the hallway and back. Right. So that's what I always picture as far as those scenarios go. Okay. Did you do any home health at all? Out of your clinic, next to any home health?
We do not, no. We only have we have now 2 occupational therapists. One is a certified hand therapist, and he works out of our Baldwin location. His name is Jeff. And we just recently hired a new grad OT. Her name's Avery. And so this is her first week, actually. So those are our only 2 OTs for the entire St. Louis region. So kind of just to give you an idea of how, I guess if I had to steer people in a direction, I would steer people toward PT. And it's not just because I'm a PT, but PTs can also become certified hand therapists. So you have more versatility and flexibility with PT versus if you go OT, yes, you can still get certified in hand, but you have less flexibility in the paths you can go down with that degree versus a PT degree. So not that we don't need OTs, but like I said, our PTs can get certified hand therapies as well. So they're probably just a little more adaptable and we can plug them into more places. Okay, that's what I wondered because I felt like with the PTs being pretty saturated, but at the same time, only OTs, if there's one per 20 PTs or something like that, right? Right. Yeah. So. Okay. We don't tend to have difficulty finding OT. We have a harder time recruiting PTs. The baby boomers have hit the therapy realm now. So trying to find PTs to cover the boomers is a bit challenging. So you've got, all of those total joints that we were talking about, plus the younger generations we still are trying to treat as well with all of our sports injuries and things like that. So we're having to scramble a little bit and get a little more creative with our time management in order to make sure we're able to care for everybody for the volumes that we have.
Right. So right now, especially with your younger, I know we're not seeing as many younger athletes right now because they're just not playing as many sports right now. But as far as dealing with COVID, are you doing a lot of Zoom or a lot of online therapy, or have you transitioned to that?
We did in the beginning. Our volumes went to about a quarter of what we normally would be. So in the beginning, we did as much telehealth as we could to make sure that our patients were still getting the services that they needed. But that still negates, I feel like most physical therapy, if it's good physical therapy, is going to be maybe 50% exercise, but it's going to be 50% hands-on, something like doing soft tissue work or joint mobilization or, things like that. So you can still, progress your patients as far as their exercises go, but we're limited in, that other area. So as soon as people started understanding COVID a little bit better, and, we as a company did some things in our clinics also as far as making sure tables are spaced out. We have 6 feet between each table. We figured out what our cleaning processes were going to be, things like that. So we were able to get our patients back into the clinics safely. So we watch our volume, like I said, we rearrange. So we're 6 feet apart. Everybody wears masks, patients and therapists. So for the most part, our volumes have steadily increased to almost what they were pre-COVID. But now that we're seeing an influx of more positive cases, we have seen a slight dip, but not near to the degree that we did when COVID first hit.
You mentioned this earlier. I'm going through some of your background and then things that you guys do. What you call industrial rehab. Is that kind of your workers' comp, working with people? And are you doing that on site too? So you say you're assessing places as well?
Sure. So work comp's really pretty interesting, and there are lots of things you can do with work comp. So, we can do just traditional therapy where we actually just treat the injuries that they've sustained on the job. So maybe they hurt their shoulder or they tore their rotator cuff. But the additional certifications that we get for job site analysis allow us a lot of different paths. So for job site analysis, we go in, obviously we assess the job site where there have been a fair amount of injuries. Sometimes companies will just hire us to assess every position. But we'll assess the position, take measurements of the workstations, and identify any risk factors, like if they're having to reach too far or reach overhead, those kinds of things.
Sure.
Problematic, or if the lifting is too frequent or too heavy, trying to figure out modifications there too. So what we do then is we write a job description. So they're called a functional job description that lists what the actual job demands for that position are. And then we start testing those before they hire employees for those positions. We test them and simulate those tasks that they'll have, so that we can make sure that they can actually perform those tasks safely and for the amounts of weights or repetitions that they're going to be performing them too.
Yeah, sure.
So we'll do that part. And then, even in a perfect world, so we'll treat the injuries when they happen. They should be much less frequent since we've done all of that, on the front side.
Sure.
And then we do a fit for duty before they go back to work to make sure that that injury is fully rehabbed and they're not going to re-injure themselves when they go back. And then a few other things that we do would be like work hardening. So sometimes if a job is very intense, so say somebody's a laborer or works in a factory where there's a lot of heavy lifting, those patients can come in after we've actually rehabbed their injury. So range of motion of the shoulder is normal, strength's normal. But because the job is very intense, we want to make sure that they can handle several hours of actually performing those job tasks again. So we'll have them come in for 4 hours a day, and we have them work for straight 4 hours doing some of their physical therapy still, but mostly simulating those tasks. So they might be climbing and lifting and pushing and pulling and digging in a pit or climbing in and out of a semi-cab. We have lots of different things in our work hardening areas that we can pretty well simulate a job.
Right. No, I love that because we use a lot of, and I know a lot of younger, or I guess students and people going into PT, even strength conditioning, fitness. We want to work with athletes. We want to help people, run faster, jump higher, and we set up a lot of like performance pyramids, right? As far as what ultimately your performance is. If you're an athlete, you want to jump and play volleyball, but we kind of compare that to activities of daily living. Like, what are your ADLs? What are you trying to do throughout the day? Do you need to walk steps? Do you need to pick up your grandchild? So I like that as far as an element of what does your functional kind of day look like on a work site. So I dig that. That's something to incorporate into my kinesiology class that I do a lot, right? We always just compare, let's do a joint action muscle analysis of a squat versus picking up a bag of mulch while you're gardening versus getting up on a crane at a work or something like that. So, and what does that look like? So, awesome, cool. I'm kind of jumping around your website too as I'm kind of asking some of these questions too. So that's why.
Yeah, that's fine. Yeah.
Somebody who's awesome. All right, so Gretchen, to give you a chance to talk a little bit and ask you a couple questions. I know, so Gretchen does a lot of marketing, among other things, at Apex. And so it's one thing to be awesome at physical therapy. It's one thing to be great at doing your thing and helping people. But as far as letting the world, letting the community know about you, what are things that you do? Are you a physical therapist? Are you just our marketing director? How did you get into working with a physical therapy clinic?
So I am actually a marketing manager. I graduated with a business administrative degree with an emphasis on marketing. So I'm not a physical therapist, but I started right out of college working for an orthopedic office for an orthopedic surgeon. So I kind of got the background of what he did from his perspective, what kind of therapy he liked, what kind of surgeries he did, workers' comp, things like that. So I was actually kind of thrown into that role pretty quickly and into conferences very quickly and getting to learn that world of insurances and just like terminology that I never learned in school. And I think that is the best way to learn marketing because you are marketing yourself. So even I was working for this orthopedic surgeon, I met Apex Network physical therapy representatives and numerous other representatives from different companies. And that's how I kind of got into this role. And marketing yourself is the biggest part in this world because so many people do kind of switch around from job to job, just like any other field. But I remember the doctor I worked for knew this one therapist at this one company, and they did a really good job, communicated well, did good work, and got his notes in on time, everything. When that therapist changed jobs, he remembered that. So then he would go there. So my biggest emphasis is I market the company, but I rely on them, like the therapist, as much as myself, because they're really the ones that are running this business, care of the patient, communicating to doctors, and filling them in on their patients, because really the therapists are seeing them way more than the doctor. The doctor sees them maybe 10 minutes, every 3 months. You guys see them 3 times a week or 2 times a week. And so relying on them is the biggest thing for marketing in a sense. Really?
No, because we have a lot of students, we have an exercise science minor here. And then a couple of these students also, I know maybe Joey's a business major. We have a couple of different degrees that might be taking this because they're interested in exercise science, but they don't know if they want to be the technician. They don't know if they want to be the therapist or the trainer, but maybe they want to be an owner. Maybe they want to be a marketing, manager, but stay in the exercise science realm, I guess. And so I totally dig that. But understanding that communication then. Michael just asked a question, so let me throw that up here real quick as soon as I hop up there. What are some key strengths you look for during your hiring process? So Michael asked.
So kind of to Gretchen's point, a lot of it is about personality. So I look to see, what are the persons, especially like with a new graduate or anyone for that matter, but what are your goals? Do you have goals? As far as, okay, you just graduated, you're probably burnt out a little bit, right? But where are you thinking that you want to head your career? Because we all have specialty certifications beyond our degree. So I want to see that somebody's motivated and already thinking, about those things.
Yeah.
But a lot of it is personality, because you have to be marketable. If you're not enthusiastic and excited about your job, sometimes or most of the time, our patients are in pain, so you don't want to not be outgoing and compassionate and caring. If you don't exude those qualities, then the patients aren't going to want to continue to come to you. They might come to you for the time that they hurt their shoulder, but the next time when they hurt their knee, they may go, that person was okay, but I think I'm gonna check somebody else out. So you definitely have to have those interpersonal skills. People want to keep coming to you because, word of mouth is huge for us too, as far as marketing. I mean,
Yeah.
Gretchen can go out and, hit the pavement every day and get in front of doctors and referral sources all of the time. But if we're not engaging those patients when they come to us, they're not going to stay with us. It doesn't matter how hard she works. So you definitely have to strengthen those interpersonal skills, because, we're going to put our new graduates with, seasoned therapists. So we can teach them, the craft. But if you don't have the personality to work with the, with the public, basically, that's going to be a huge barrier for growing business. Which, fortunately and unfortunately, we all go into therapy because we want to help people, but it's still a business. So you have to be able to look at both sides of that. And to your point, you were asking or mentioned owning your own business. Apex has franchise opportunities too. So we have both corporate clinics and franchises. So it's absolutely realistic that, you can graduate from your program, open your own franchise, and have, not just a therapy business, but also, you could incorporate your training, have a training side of, that business as well. So there are lots of different opportunities whenever you're thinking about therapies, but you have to have the right people in the right places.
And to kind of bounce off that, how big social media is right now, if you don't have that right person in the clinic treating that person, everybody knows you leave a bad review over a good review. Mm-hmm. So if you go on Google, everybody knows that. So if you go on Google review or Facebook or Yelp or whatever, you're going to see, oh, Beth treated me really well, or yada, yada didn't. So, hiring the right person that has those qualities of being comforting and being personable will really go a long way with the doctors, with the patients, and for the community.
So as far as, let me, if I can shoot this up real quick, like on your page, when we talk about how do you balance, and this is a question for both of you, but kind of balancing who you want to work with, demographic wise, age, and what kind of ache or pain, maybe to be a lower back specialist versus a specialist for 80-year-old men versus the tools that you use, right? So to tell people that you you use dry needling, for example, I don't know, Gretchen, and just some of you, because Beth gave me all kinds of awesome reading material. So I'm kind of looking through all the different, aquatic therapy, physical therapy. Oh, I lost Beth and Gretchen again. I don't think they're wired in. So we always have to stay wired in on Ethernet. So hopefully they'll jump right back. But I'm asking them because, and I'll ask this question again. You there?
Yeah, yep. Sorry about that.
No, that's all right. So here's something I'm kind of asking a question, just something to comment on. I talk to my students a lot about this, that you can either think about, I don't know, just to give 3 examples, not to just be a PT, but maybe be the sacroiliac specialist in the area. Like a doctor, when a surgeon or doctor thinks you have a lower back pain, go see Beth. She's awesome, right? She knows spinal care, the McKenzie technique, yada, yada. Or is it the tool or to focus on, I want to be great at dry needling or active release therapy or something versus the demographic? Like I want to work with this sort of person. Can you speak to that a little bit versus being kind of a jack of all trades, which there's a place for that as well, versus how much to kind of really focus on one demographic or one tool or one body part, if you will?
Yeah, not to say that people don't completely specialize, like especially like if you get into the women's health arena, you'll see that that's all those therapists do is women's health for the most part. But if you are about outpatient PT or outpatient ortho, you kind of have to have lots of tools in your tool bag, basically. So we try to be as well-rounded as we can be. A lot of our therapists are certified for dry needling. We encourage our therapists to go back for additional certifications. We all have to have continuing education. We're required to have 40 hours every 2 years. That's just to maintain licensure. So instead of just taking, we can all just take an online kind of a wastebasket refresher course that will suffice those requirements. But do you want to do that? So we encourage our therapists to take meaningful courses. So carve out niches for yourself. So yeah, you can be the low back specialist, but you're still probably going to end up seeing a handful of other conditions, be it an older person with balance issues or, a total knee replacement or whatever. So you need to be well-rounded, but you definitely can carve out that niche, and the doctors do remember that. So I would say I get a fair number of referrals because of spine and the dry needling that we do. Definitely get referrals because we're concussion certified. And then we have other therapists who have manual certifications, who have orthopedic certifications. So it's definitely worth carving out a niche for yourself, and it just makes you that much more marketable. A, when you're looking for jobs, and B, when you're marketing yourself to the community or to the doctors, the whole gamut, basically.
Sure. So Nick kind of took my question here, and I want to talk a little bit about certifications or different routes you can go or specializations. But I know some of these athletes have been to a chiropractor, for example. So you get acupuncture, which might be a very surface level needle, right? That's being put in for one reason, or you might get a deeper needle put in with like an electric stim to kind of do electric stim, that's not with the pad on the surface, versus dry needling. Can you talk a little bit about that? So Nick asked the question, how exactly does dry needling work? Can you speak to that a little bit? That just seems to come up a lot. Everybody's interested in dry needling. Are you hearing me?
Repeat that one more time for me, Dave.
Dry needling. Can you talk a little bit about dry needling?
Dry needling. Yeah, as far as dry needling goes, it's probably one of the best certifications I've gotten. I guess I've been doing it 2 years now, but basically with the dry needling, we're needling into trigger points. And the difference between dry needling and acupuncture is acupuncture is based on Chinese medicine and the flow of qi along meridians, whereas dry needling is based on trigger points. So Travell and Simon years ago mapped out all the trigger points and the referral patterns. And so we needle into the trigger point. I have a feeling if you did a study and compared the two, there probably would be overlap of the meridians and the referral patterns. But I haven't seen that study today. So we use the same sorts of needles, the same approach. Technically, probably the one thing that we do differently than acupuncturists do is we hook electrical stimulation to the needles. So you're getting, instead of superficial electrical stimulation that you might get in the athletic trainer's office, our needles are actually in the trigger point with stim going down into the trigger point. So that's where we get the most bang for our buck. And those areas where there are trigger points are, it's a tightened area of muscle. So you're not getting blood flow into that clamped down area. So inflammatory cells stagnate in the area, lactic acid builds up in the area, and then that in and of itself becomes painful. So your injury was painful, now you've got this painful trigger point, and it just perpetuates itself. So by needling into it, it elicits what's called a latent twitch response. And so that twitch response is kind of like a little flutter of the muscle or a small contraction. So when it contracts and relaxes, it allows an influx of new circulation into the area. So it has like a flushing effect. So those inflammatory cells are flushed out, new circulation comes in, helps promote healing. And then because the muscle has relaxed for a second, that's the prime time to stretch it. So immediately after we needle, when the muscle is most in its resting position, we start stretching again to try and restore that normal resting length, because a muscle can't work optimally from a shortened position. So we see great results with the dry needling.
Cool. So you use an electric stim needle every time?
So it's like a little alligator clip that we clip onto the needle once it's inserted.
Okay. Very cool.
And speaking from somebody that Beth has performed on, it works very well. I've had it done twice. It's very well, yes.
And certain body parts better than others? As far as tendonitis versus, lower back pain, something like that? Is there
We see
certain
great
times?
results with, there's all kinds of different protocols. I see great results with the spine. I see great results with rotator cuff, especially like if it's very limited in range of motion, more like a frozen shoulder. Quad strain, knee pain. The only place, and we totally can needle for plantar fasciitis, but I can tell you I had it done to myself whenever we went through the certification, and I don't really want anybody to ever stick me in the foot again. It's pretty uncomfortable. The rest of the areas, though, they're not painful at all. You'll just feel a little poke. And then pressure is probably the best way to describe it. But I will say, I think the foot's uncomfortable. So I don't typically needle for plantar fasciitis. I don't typically needle the foot.
Right. So that's a different.
We use it for PMJ, like I'll needle the face.
Sure.
What's that?
I said, sure. Yeah, I can see that. Can you hear me?
Intermittently, I can. But so, yeah, we'll put needles in the face for TMJ. We'll put them at the base of the skull for headaches, whiplash kinds of things. We'll stick them in any muscle just about. So.
Sure. So that's one of many certifications, right? So as far as just getting specialized certifications, are those aside from continuing education, or is that something different? You catch all that?
Now we got you. Sorry, can you repeat that again?
Yeah. So dry needling is like a certification, right? So is there different specialties you can study like that? Is that counted as a part of your continuing education?
Yeah, so it's a continuing ed.
Like a 12-month thing, an 18-month program, something like that? Or how does that work to become like dry needling certified, for example?
So once you've completed the physical therapy program, then you can sit for additional certifications, be it your orthopedic specialty certification or, like we said, concussion management, dry. Depending on what it is, determines the duration of continuing education hours that are required. So the dry needling is probably one of the more time intensive, and so dry needling was basically a week-long certification course. Concussion is a week-long certification course, whereas the orthopedic certification is kind of a self-study and you just sit for the test. So it really kind of depends on, what you're looking to do. Women's health would be more lengthy. The job site analysis and functional capacity evaluations, like a 3-day weekend. So, and some of them require recertifications periodically. The concussion one does, just because concussion studies and literature is really still evolving. So you have to get recertified in that every 2 years. Whereas a lot of the other certifications, once you're certified. So you can you want to look into that too.
Jump again. I don't think they're wired in. So I'm going to ask him about the concussion protocols. So they built a lot of, we'll talk about dizziness, vestibular work. So again, these are all just different things you guys can go into, just different ideas. It's not just physical therapy, but you can get into a lot of these different types of things. So, got you again? You there?
Hey.
So I want to ask about, let me just throw this up here like this. So about concussions, as far as how much you're doing with concussions, we talked a little bit about that versus just vestibular work. If someone's coming in for dizziness problems, balance problems, versus doing any sort of assessments for concussions.
Sure. So for concussion, sometimes concussion and vestibular work goes hand in hand. Sometimes that is their primary complaint, which is vertigo and dizziness or imbalance. And then sometimes that has nothing to do with it. Sometimes it's completely headaches, migraines, neck pain. So sometimes concussion can present almost like whiplash. because, they've taken most of the time it's been a forceful whipping or a blow to the head. So you can imagine how much their neck can hurt also. So we might be treating headache and neck pain. We might be treating vertigo and imbalance. It really just kind of depends. But yes, I've got a couple of patients right now. So one girl, she's actually had a very long-standing history, and I've been seeing her for a couple of months now. She has both headache and dizziness, and the headache part is mostly better as long as we keep her out of fluorescent lighting. So she does a little bit of bike, just so we can monitor her heart rate and her response to that. In the beginning, it used to cause a headache. Now it doesn't. So she's seen quite a bit of improvement there. But if I put her on an unstable surface, like a piece of foam to stand on and have her do anything dynamic, she loses her balance. So we've done canalith repositioning for the crystals in the inner ear, because she did have positive fat. And then we continue to do gaze stabilizing exercises. So her vestibulo-ocular reflex is still pretty impaired. So she has difficulty with tracking. So when she's reading, she has a hard time staying on the line. So she has to use a note card to go down each line so she can stay on task with that. Wow. But yeah, I was just working with her again yesterday, and she's better as far as her balance goes. But she definitely has still has some significant deficits. Yeah.
As far as careers go, so a lot of these students are freshmen, they're sophomores, they're looking at DPT programs and MOT programs. As far as their career path right now, opportunities for observation hours, for tech positions, aid positions, how does that work at Apex as far as who you hire, what's the aid look like or technician look like versus, your clinical students?
Sure. So we definitely do hire technicians. They're a PRN position, so it's very much volume dependent. So when we're busy, the tech is busy. When we're not, they're not. So you can absolutely do observation hours and come in and shadow with us, or you can, if there is a position available. We've just hired 3 techs recently, so right at this minute, I don't have any opportunities on the St. Louis side for a tech. But like I said, they pay minimum wage, but at least you're getting your observation hours in at the same time and getting that experience. But techs are very important to us because they do a little bit of everything. Obviously, they're kind of my right hand. They're grabbing my weights for my patient or TheraBand or getting me a hot pack or, whatever I might need as far as instruments go and setting things up. We talked about being in the marketing in the business side of therapy. So if I'm busy with another patient, they might just simply be engaging the patient who's waiting on me, just so that they don't feel like they're not being attended to. But they also do other things, like they'll clean, they'll help schedule, they can take copay. So really just the whole gamut, really. They're definitely a big asset to our clinics.
And as I'm looking at your career opportunities on your website, looks like you're everywhere. You're Boca Raton, Florida, you're in Arizona, Arkansas. But we have students from different places. So if we have a student who goes home for the summer, we're cutting out again. We're cutting out.
We're walking with you, trying to get a better connection here.
Sure. So for your students, if you're going home to Arkansas or Arizona or Chicago, I want to ask about opportunities or that sort of thing, both for physical therapy, tech, or aid. So if you look at the website, it actually says PRN physical therapist, physical therapist, tech, or aid. It sounds like tech or aid is sort of the same thing. So if you apply for a job as a tech or apply for a job as an aid, that's a part-time position. But the key is that you can make a few bucks plus get your observation hours. And Apex is a pretty wide network, and Beth is the regional director. She has a lot of connections. So I think she'd be a good person to talk to no matter where you want to get a job. So I think that's key as well. I got you back?
Perfect.
Sorry about that.
No problem. So I always talk to students about that idea that they can make a few bucks and get observation hours. And so I'm looking at your website. You guys are everywhere: Florida, Arkansas, Arizona, Belleville, different areas. Now, when you say you're regional director, what's the region?
So our region is Creve Coeur, Frontenac, Chesterfield, Baldwin, Oakville, soon to be Sunset Hills. I'm obviously in Webster Groves. And then we do have a little outlier out in Springfield, Missouri.
Okay, awesome. All right. Because we have a lot of students from all over the place, right? So a lot of the athletes especially come in from Chicago and Illinois and Texas and Miami, Florida, everywhere. So it's nice. As far as I'm looking at the website, a PRN physical therapist, is that like a full-time PRN? Is that on call for like any number of clinics in an area? Is that what that would look like?
That is basically a float position, the one that you're probably looking at now. So our clinics, like I said, have been growing, thankfully, in the St. Louis area. So and to get to that next level where you can actually justify having a two clinician clinic, you have to have PRN staff to help get us there. So, just because I'm too busy for one person doesn't mean I really can financially support bringing on another person with full-time benefits. So, insurance, 401k, paid time, off and things like that. So you have to think about that when you're looking at your business model. So we always have some PRN staff that will float between clinics. That way, when we do have a growing clinic, we can plug them in to get them additional hours to accommodate the increasing referrals before we actually bring on a full-time person who is going to, like I said, have those benefits that we're going to have to pay for. So you always want to have a few PRNs in your back pocket in case you need them.
So how about a physician assistant? So I'm looking at your site now as far as a job description of a physical therapy assistant. Sorry, I got PA on my mind.
Yeah, no, you're fine.
A PTA or an OTA. Do you have, how many in your network do you have for PTAs or positions available?
Yeah, we do have PTAs. And sometimes, actually, I just hired a couple of PTA floats also. So PTAs are super helpful for us also. So they can do most everything except for the evaluations. Some insurances have some stipulations surrounding PTA. So like Medicare, TRICARE, which is military, you cannot see their patients if you're a PTA if there isn't a PT on site with you.
Right, that's a primary on site.
But they have to be, we have to have supervision of them. But all other insurances they can treat even if I'm not in the clinic.
What's the salary range for PTA?
Right around 16 to 18 to start. And then, obviously, as you become a seasoned PTA, you're probably into the low $20 per hour range.
Okay. But with full-time jobs available?
There are sometimes full-time jobs available. Right now in my area, there's not, but there most likely is, since we have almost 90 clinics, I'm sure there are probably some PTA jobs out there.
Okay. When I went to school BYU for my graduate degree, and a lot of athletic trainers were looking into becoming PAs also, or PT, PTs also. And I talked to some students who are kind of understanding PT and what it means to be a PTA, and possibly combining that with being like a personal trainer, kind of being in the fitness world, but then also a PTA. And I think with the continuing, ideally the evolution of fitness and rehab and and trainers understanding what a decent corrective exercise is or what that looks like, or be able to just communicate with PTs. I think that's so important, as far as just speaking the language and understanding. I see a lot of my clients, I'm a personal trainer too still, they come in with a script, or this is what I did with my physical therapist, can you help me, this is my homework, that sort of thing, going through a lot of those exercises. So that's why I'm kind of curious of the PTA.
Yeah, it's super helpful to have somebody like that to be able to transition our patients to. So when we're developing networks and relationships like that, those are the people that we look for, because I don't want to just send my patient to Joe Schmo down the road gym, who may not really, they may be throwing all kinds of exercises at them that aren't appropriate for the injury that they just rehabbed. So yeah, definitely knowing your trainers and communicating. So a lot of times whenever I know the trainer say my patient will give me the trainer's name and number, I'll even call them and just say, hey, these are the things they shouldn't do. Knock yourself out, do whatever else you want to do, but don't do A, B, and C. And so most of the time they're pretty receptive to that. But
there's a lot of trainers out there giving us a bad name, so it's pretty ugly.
Well, hey, that happens in any career. So there's good therapists and bad therapists too. So
yeah, sure. All right, last question, and thank you so much for this time today. Henny. So Henny's actually a physician, or physicians of mine, a tech. He's a PT tech at an Athletico clinic, but he's asking, how different is the education for PTA versus PT?
So PT is 6 years, and you end up with a doctorate, whereas PTA is an associate's degree. And there are some prerequisites that are required before you get into the program. So it ends up being close to 3 years. It's 2 years of actually being in the associate's program, but usually a year of the prereqs before getting accepted.
Because we've looked into those some, but they're mostly in the junior college areas, right? I know.
Yeah, they tend to be. Mm-hmm. Yeah, SWIC has one on the Illinois side. So
yeah, that's just something I've explored as far as a director here. Is that as far as students going into PT and whether they want to go the full PT route or if PT is an option, and if something I can sort of intertwine into our program, I'm kind of exploring that. By the time they're a junior and they're saying, I'm not sure I want to do PT, but can they stick around and do enough to get their PTA? So
right.
I'm exploring. So awesome. All right. If there's another question, type it up very quickly. Otherwise, I'll let you guys go. Beth and Gretchen, thank you so much. This has been great.
Yeah, no, absolutely. Sorry about the connection. I think we figured out it was the room that we were in. So if we do this again, we'll make sure we're not in that room.
No, right now, yeah, this is probably the most clear. And,
well, we appreciate you guys having us. And like from a marketing perspective, follow us on Facebook. We have Instagram. Check out our website. Our website is brand new, so I'm glad you did that, or we just redesigned it. So
that's been nice. It's been easy to find everything. So yeah.
Perfect. Awesome. No, well, that's the key there. So yeah, follow us. I'm on LinkedIn. I know Beth's on LinkedIn. I know that's a big thing right now, especially if you're looking for jobs and getting more insight. So we're on those. Check us out, like us, or come out and check Beth out at Webster Groves.
Yeah, come visit us.
We're in the clinic right now.
How are you doing observation hours right now? Is there any opportunity to do some observation hours?
Sure. Yeah, we don't have any restrictions on that. We check temperatures when people come in. We have a screen, so if you answer wrong in the screening question. But beyond that, you're wearing your mask and taking all the precautions. So yeah, we still allow shadows and we still take students. So I have PT students. I'll have another one in January. So.
Okay, fantastic. Because I think we'll have students contact you. That'd be great.
Yeah, absolutely.
Yeah, right. And if there is a different clinic besides this one that you would like to go see, if you live closer to Frontenac or Belleville or any around those, any of our clinics are very open to those. Just reach out to the front desk or one of us, and we can arrange that.
Awesome.
Yep.
Awesome. Thank you so much for that.
You're welcome.
Yeah, absolutely. Anytime.
All right. Well, thanks again. Have a wonderful day, and I'll be in touch about this and more.
All right, guys.
You as well.
All right. Yeah.
Bye.
All right. So that was good. And a lot of the clinics just are not doing observation hours right now. So if they are doing observation hours, I know it's early for a few of you, but a few of you, it is time to do some of these. So you can't get going on observations hours soon enough, not only because you need a certain amount of hours, right, but also because just to be in a clinic, just to stand next to Beth, watch how she works with someone, look at the tools that she uses. Like I think what Nick, you asked about dry needling, just, maybe get a hold of her. You can email her and say, what day are you going to do dry needling on a patient? Can I come check that out? And that sort of thing, just to learn, just to be in a clinic, look around, and because that's what it comes down to. Like I work in this studio space. You've been in this studio space. This is like so much of my world. Like I got to be pretty darn happy coming here and just existing in this world all the time, versus in a big public facility that I've been in before, or even up on campus more, or that sort of thing. So to walk into a clinic and just look around and say, is this somewhere I could come every day? 40 hours a week for 10-hour days, and the type of people I want to work with, is this who I want to help, that sort of thing. So I think observation hours are invaluable in that way. So so email me, and then I'll shoot you Beth's email and Gretchen's email and hook that up. And I said not only the Webster Groves location, but they can do other locations as well. So Apex will be an awesome networking partner and a place where we hopefully will do clinical hours one day as well. So that is it. I'll shoot you an email about next Wednesday. Although it's 10 a.m., I'll shoot you an email. I know everything's changing on campus a little bit. Most professors are going all virtual for the next 2 or 3 weeks, really just 2 weeks left of school. Last thing, make sure that you fill out that survey that I posted online. I want to get an idea of the program. I know you're all thinking different routes. Whether it's sports nutrition, physical therapy, you want to own a CrossFit gym, you want to go into personal training, you're going into maybe the business of exercise science, please fill out that survey. I sent you 5 questions. I want to cater to, I want to develop better isolated or focused programs for each one of you. There's not a lot of changes we can make, but I think as far as networking with someone like Apex, we can network with a lot of different industries, a lot of different people in order to optimize your experience, make sure you're getting good observation hours, the correct information, the correct knowledge and skills that you can go out and, rock and roll when you get out of this place. So, all right, have a great week. And I will just stay in touch. I'll stay in touch. I'll shoot you an email on off of a Canvas or Connections and get a hold of you about next Wednesday. All right, go outside and get some vitamin D. See y'all.